Welcome to our comprehensive guide on nutrition interventions. In this video, we'll explore how planned nutrition actions can prevent malnutrition, treat existing nutritional problems, and improve dietary habits at every level, from individuals to entire communities. Nutrition interventions are more than just recommendations. They are strategic efforts that shape public health, reduce disease, and foster healthier generations. Whether you're a health professional, educator, or simply interested in well-being, understanding these interventions is key to making a lasting impact. Let's begin by defining what nutrition interventions are and why they matter. Nutrition interventions are planned actions designed to prevent malnutrition, treat existing nutritional issues, and improve dietary intake and nutrition-related behaviors. These actions target individuals, households, and entire populations. By focusing on both prevention and treatment, nutrition interventions help address immediate and long-term health challenges. They are essential tools in public health, aiming to create sustainable changes in eating habits and overall well-being. As we move forward, we'll see how these interventions are structured and why they are so important for communities everywhere. Nutrition interventions play a vital role in public health. They help reduce morbidity and mortality, improve growth and development, and enhance human capital. By breaking the intergenerational cycle of malnutrition, these interventions ensure that future generations are healthier and more productive. The benefits extend beyond individuals, strengthening entire communities and supporting national development. Understanding this broader impact helps us appreciate why nutrition interventions are a cornerstone of public health strategies worldwide. Nutrition interventions can be classified into two main types: nutrition-specific and nutrition-sensitive. Nutrition-specific interventions directly address the immediate causes of malnutrition, such as inadequate dietary intake and disease. On the other hand, nutrition-sensitive interventions tackle the underlying determinants, including food security, care practices, health services, and access to clean water and sanitation. Both types are essential and often work together to create lasting improvements in nutritional status. Nutrition-specific interventions focus on the immediate causes of malnutrition. This includes addressing inadequate dietary intake and managing diseases that affect nutritional status. Examples include providing micronutrient supplements, therapeutic feeding for malnourished children, and treating infections that hinder nutrient absorption. By targeting these direct causes, nutrition-specific interventions can quickly improve health outcomes, especially in vulnerable populations. Nutrition-sensitive interventions address the broader, underlying factors that contribute to malnutrition. These include improving food security, promoting better care practices, enhancing health services, and ensuring access to water, sanitation, and hygiene wash. Social protection programs also play a role. By creating an environment that supports good nutrition, these interventions help prevent malnutrition from occurring in the first place. Nutrition interventions operate across several core domains. These include food and nutrient delivery, such as food fortification and supplementation, education, through national campaigns to improve knowledge, counseling, offering targeted advice for behavior change, and coordination, which involves collaboration with health, education, and social sectors. Each domain plays a unique role in ensuring interventions are effective and reach those who need them most. In Ethiopia, community-based nutrition (CBN) is a key strategy. CBN engages communities directly, focusing on prevention and early identification of malnutrition. By integrating nutrition into primary health care, CBN ensures that interventions are accessible and sustainable. Community involvement is central, empowering local people to take charge of their nutritional health and support one another. CBN programs include several important components: growth monitoring and promotion, community nutrition education, referral of malnourished children to appropriate care, and behavior change communication. These elements work together to identify at-risk children early, provide families with the knowledge they need, and ensure that those who need help receive timely support. The result is a stronger, healthier community. Essential Nutrition Actions (ENAs) are evidence-based, cost-effective interventions designed to improve the health of mothers, newborns, infants, and young children. ENAs focus on the critical first 1,000 days of life, a period that shapes long-term health and development. By targeting this window, ENAs help ensure children get the best possible start in life. The 7 ENAs include optimal exclusive breastfeeding, appropriate complementary feeding, maternal nutrition, prevention and treatment of diarrhea, vitamin A supplementation, iron and folic acid supplementation, and prevention of iodine deficiency. Each action is based on strong evidence and is designed to address the most common nutritional challenges faced by mothers and young children. Both CBN and ENA have had a significant impact in Ethiopia. They have improved infant and young child feeding practices, increased community ownership of nutrition programs, and strengthened the linkages between communities and the health system. These successes demonstrate the power of well-designed, community-focused interventions in improving public health. Nutrition education is a cornerstone of effective interventions. By improving knowledge and attitudes, nutrition education influences dietary behaviors and supports the sustainability of interventions. When people understand the importance of good nutrition and how to achieve it, they are more likely to make lasting changes that benefit themselves and their families. Behavior Change Communication, or BCC, is a strategy that addresses barriers to healthy behaviors, reinforces positive actions, and engages communities in the process. BCC uses tailored messages and interactive approaches to motivate people to adopt healthier habits. By focusing on real-life challenges and solutions, BCC makes nutrition interventions more effective and relevant. Nutrition and health messages are delivered through various channels, including health facilities, community meetings, media, and schools. Using multiple channels ensures that information reaches a wide audience and is reinforced in different settings. This approach helps create a supportive environment for behavior change and maximizes the impact of nutrition intervention. While undernutrition remains a challenge, childhood overweight and obesity are emerging problems, especially in urban areas of Ethiopia. These issues often coexist, creating a double burden of malnutrition. Addressing overweight and obesity in children requires a different set of strategies, focused on prevention and healthy lifestyle promotion. Preventing childhood overweight involves promoting balanced diets, encouraging physical activity, and limiting the intake of sugary and processed foods. These strategies help children maintain a healthy weight and reduce the risk of related health problems. Community education and supportive environments are key to making these changes sustainable. Effective nutrition interventions begin with careful planning. The process includes identifying the problem, analyzing the situation, setting clear objectives, selecting appropriate strategies, and mobilizing resources. Each step ensures that interventions are tailored to the specific needs of the community and have the best chance of success. Nutrition interventions require the involvement of multiple stakeholders, including government agencies, NGOs, communities, and the private sector. Each group brings unique resources and perspectives, making collaboration essential for success. Engaging stakeholders from the start helps build ownership and ensures that interventions are relevant and sustainable. Implementing nutrition interventions involves several key considerations. Capacity building ensures that staff and volunteers have the necessary skills. Effective supply chain management guarantees that resources reach those in need. Community participation and cultural appropriateness are also vital, as they help tailor interventions to local contexts and increase acceptance. Despite careful planning, nutrition interventions often face challenges such as limited resources, weak coordination among partners, and resistance to behavior change. Recognizing these obstacles early allows for the development of strategies to overcome them, ensuring that interventions remain effective and reach their intended goals. Monitoring and evaluation are crucial for tracking the progress of nutrition interventions. M&E helps improve accountability, inform decision-making, and ensure that interventions are achieving their intended outcomes. Regular monitoring allows for timely adjustments, making programs more responsive and effective. Key indicators used in monitoring and evaluation include coverage, compliance, and impact. Coverage measures how many people are reached by the intervention. Compliance assesses whether participants are following recommended practices. Impact evaluates the overall effect on health and nutrition outcomes. Together, these indicators provide a comprehensive picture of program success. Ethical and equity considerations are fundamental in nutrition interventions. Programs must prioritize vulnerable populations, avoid causing harm, and ensure inclusiveness. By focusing on fairness and justice, interventions can help reduce health disparities and promote well-being for all members of society. Nutrition interventions are most effective when integrated across multiple sectors, including health, agriculture, education, and social protection. This multi-sectoral approach ensures that all determinants of nutrition are addressed, creating a supportive environment for lasting change. Collaboration between sectors maximizes resources and impact. The Secota Declaration is a national commitment in Ethiopia that exemplifies multi-sector coordination. Its primary focus is on reducing stunting among children by bringing together health, agriculture, education, and social protection sectors. The declaration demonstrates how high-level commitment and collaboration can drive significant progress in nutrition. Sum up, nutrition interventions must be evidence-based and use both direct and indirect approaches. Community engagement is essential for success, and ongoing monitoring and evaluation ensure interventions remain effective. Finally, multisectoral collaboration enhances the reach and impact of nutrition programs, making them more sustainable and beneficial for everyone involved. For those interested in learning more, several key resources are available. The World Health Organization's Global Nutrition Policy Documents, the Food and Nutrition Policy of Ethiopia, and the Ethiopian National Nutrition Program provide in-depth information and guidance on best practices in nutrition interventions. These readings can help deepen your understanding and support your efforts in promoting better nutrition. Thank you for joining us on this journey through nutrition interventions. By understanding the strategies, challenges, and successes in this field, we can all contribute to healthier communities and brighter futures. Remember, effective nutrition interventions require evidence, collaboration, and a commitment to equity. Stay informed and keep making a difference.